Like a lot of people, you've put a lot on hold. Eating in restaurants, praying in your house of worship, attending sporting events, all to protect your health. So as we all start to get back, the same people who have been protecting your health all along are the people doing the most to keep your health safe. Always. We're open for emergency care and for appointments safely for you. CHI St. Luke's Health Memorial.
Watson-Watkins, President and CEO of the Lufkin-Angelina County Chamber of Commerce. Welcome to the Connect podcast, connecting business to community. I'm here with my great co-host, Blake Pollino with BP Media Group.
So we just got done recording an episode with the staff from Woodland Heights Medical Center, and an incredible episode as we've continued talking about the healthcare system and medical professionals in East Texas, about how great this organization has been for 102 years here in East Texas, providing high quality healthcare, and their challenges with the COVID-19 pandemic, how they've pivoted, and how we've all come together as a community. So super inspiring episode. Can't wait to get into it. So let's check that out now.
Well, we are excited to be joined with fellow friends and colleagues from Woodland Heights Medical Center. Thank y'all for being here. You helped jump on board to this podcast right off the bat when we pitched it to you back in August, and jumped right in as a sponsor. And we appreciate your continued sponsorship, especially with this new podcast. And hopefully you're getting some great feedback from it, and hopefully this will be even better. But let's start. Why don't we just start, and why don't you introduce yourself, tell a little bit about yourself and what role you have at the hospital.
Hi, I'm Deborah Taylor. I'm the Chief Nursing Officer. I've been here in Lufkin about 3.5 years now, and we just love it. We bought a little farm and have some cows, and and then our, just the staff at Woodland Heights are just so wonderful and welcoming. So this is our home now.
Where did you move from?
We're originally from Mississippi, Northeast Mississippi.
Okay.
But we moved here actually from Paris, Texas.
Oh, okay.
So.
Good old Paris, Drew.
Yep.
Sure. Hi, my name is Drew Emery. I'm the CEO over at Woodland Heights. I've been here about 15 months now. Came here from Florida with my wife and 3 kids. So we're really adapting to life here in East Texas and loving it. So we're very excited to be here and meeting all the friendly people and getting to experience all that the community has to offer.
Great.
And I'm Jamie Rice, the Chief Quality Officer at Woodland Heights. I have been in Lufkin all of my life, born and raised, and in turn I have raised my family here. I've collectively been at the hospital now for 12 years and absolutely love it. I wouldn't work anywhere else.
But you were born and raised in that hospital.
Actually, I was born at Memorial.
Were you? Okay.
Yes,
but your mama worked there.
Yes, my mom worked there at the time, so.
Okay.
She had to.
That's right. That's right. Well, we're honored to have y'all here today. It seems it's crazy. Here we are in December. We're closing out the year, and it seems to me like the last 2 months has just flown by. Whereas we couldn't get the first of the year to even get to the next day, it seemed like. So why don't you take us back to, so many months ago, January, when y'all started seeing things and hearing about things, to really when you started seeing the first case probably in March, and kind of tell us the path that you had to take to make sure that the hospital was safe and that you could control the patients inside.
Sure. Well, I'll start. Back in January when we started seeing international news, and we actually had one of our employees who had a daughter who was overseas for a college trip and was in Italy actually when it started to head that direction, and so that kind of brought a lot closer home to us. At that time, we're kind of like, well, is this really going to get to the U.S.? And there was all of those kind of talks, and then we just kind of continued on down the pathway, and as it got closer and closer, and then New York had some cases, and then we're like, all right, well, we need to take this seriously. And I have my brother's in hospital leadership out on the East Coast, and he kind of saw it much sooner than what we did. And so communicating with him, it was just, we got to get ready. And we plan, we have a disaster or preparation manual at the hospital that's 5, 6, 7 inches tall, full of policies to attack anything and anything that could possibly come our way. It didn't have a pandemic section until now. And that particular section of it continues to get revised every day as things come out. At the beginning, it was fast and furious. The CDC was changing its things daily, and so we were as well, to try to make sure that we kept all of our staff and anybody who comes to the building safe. So it was an adventure, and I certainly have learned a lot, and I've been through hurricanes personally on the front lines. I've evacuated hospitals. I've dealt with lots of other very challenging situations, and I can say that this has certainly been the longest and the most challenging when it comes to how many people are affected by the pandemic and how it's impacted our business, for sure.
How do you mentally prepare a staff, and you've got a huge staff, a huge group of employees. How do you mentally start preparing employees for what's coming at you, and that you are the frontline workers and you're going to be taking care of, the sickest of the sick? How do you do that?
Well, I think for nursing and the therapies and the respiratory therapists and the frontline staff that are in there every day, radiology, taking care of those patients, they just step right up. And I think sometimes they were preparing us because they were looking at it from the standpoint of what are we going to do to make sure, number one, this patient's safe, number two, we're safe, and our coworkers are safe. So they immediately, we had some little daily prayers that called in. It was like a call-in prayer line that different chaplains were holding for us here in town that Jennifer Stevens had set up for us. And some of our staff would call into that every morning. So it was optional for them, but it was something that was there for them. Yeah. And then our infection preventionist, she just really was out there, along with Jamie, every day working with them to make sure that what they had, the supplies they had, were adequate, or more than enough, and that they were being used appropriately. And so just mentally helping them understand that we're here, we're supporting you, we're going to get you the supplies you need. People in the community started helping us and providing PPE for us when it became obvious that you couldn't just go buy a mask anywhere or a pair of gloves and or a gown. And so we never ran out between the state and the local community donating to us and what we could buy. We never got into a situation where we had to have our staff doing something that was inappropriate or unsafe. And so we're very thankful for that. I think this community helped us stay in that type of situation.
That's for sure. Yeah. As you talk about the staff, these were very much on the front line and still are as we go through this. Do you have any stories you can tell of times where, you were touched by how the staff interacted or dealt with the situation, or kind of anything along those lines?
Many.
Yeah, we've had so many instances where we've had, staff members go above and beyond, and we've had staff members come from the state who send in angel nurses that come in and supplement our staffing when we had huge amounts of our staff go out with COVID. Sure. And so, just some of the focus that they come in with, and they're there really to help, and they've lent a hand, and our staff have gone above and beyond. And when things get dicey and you call somebody and you're like, hey, I need you to come in tonight, we're desperate, and not a single one of our staff members ever said no. And our leadership team were pulling extra shifts. We had nursing directors covering the COVID unit, extra hours, weekends, nights, working 7 days in a row, and they would have worked 8 if there were 8 days to work. Everybody's just so dedicated.
That's true. We did have several patients that, it was touch and go, and because we've had some pretty critical patients, and they stay there long periods of time because with receiving the remdesivir and the plasmapheresis treatments, they're going to be there for a little while, and then some of them it just takes a while, the older patients especially, but we've had some younger patients too, but we've had some that they're just really special to us because the staff got connected with them and really got attached. And we even had one of our state nurses that the doctors came to us, the pulmonologists, and said, if it weren't for him, I think this guy would have died. And so we got to what we call clap him out. That's right. Because he got discharged. That's and so that's just special when you carry somebody through 40,
right.
50, 60 days and they survive and they're capable of, going and caring for themselves, or, they're going to recuperate. And
right.
it's a long process, and there's so much we don't know about it clinically. But I'm very proud of our staff. They've been so wonderful with just stepping up and saying, we can do this. It's about the patient. It's about keeping each other safe. It's, making sure we had the right space for those patients and following all the CDC guidelines. Because one thing is like, I know every day, we get a new message from the CDC or somebody.
changes.
It's like, yes. And, it's like Drew and them were constantly putting out, information and trying to keep everybody posted. And I was trying to keep the clinical piece. Jamie's trying to keep the clinical piece going. And so it's just a never ending. And even today, things change every week.
Right.
At least it's not changing every minute.
That's right.
It has slowed down a little bit. Huh?
It has a little bit. We've learned a lot.
Sure.
So
And that moment came for me when the infection control director and our educators at the hospital felt a responsibility to make sure that our staff had the PPE available that they needed. In the beginning, we had run out of face masks and N95 masks, and we were scrounging to get supplies. And when the frontline staff have to wear an N95 mask, all of the staff has to be fit tested for it to ensure that it fits properly to keep them safe. And so whenever new masks would come in, the educators and the infection control nurse went to every staff member and had to fit test them properly to make sure that the new ones we got in fit them so that they could take care of those patients
Nice.
and not
Well,
worry about being infected.
Quality care has always been at the heart of what y'all have done. Tell me about having to really kind of change focus on how you're going to continue to give that quality of care while being able to maintain all of the new guidelines from the CDC and what's coming down. Because I know that has to be difficult. You've got new guidelines that you have to follow. They don't necessarily go with maybe the way that you've always done it. So how do you merge those two?
one of the biggest things that I think we saw right off is that because our physician offices couldn't just open their doors and let patients in, you still got a large population here with renal problems, their, COPD, the congestive heart failure, all the things that are chronic, and diabetes. So somebody had to still be following them. And so our physician group here did a very good job of getting telemedicine set up right away. And so I think that helped us stay ahead of some of it. But people truly were afraid to come to the emergency room even. And when your leg swells up from your ankle to your thigh, you really ought to go see your doctor. And even with telemedicine, some of that, I think it was hard to diagnose it because, some people don't necessarily tell their doctor, hey, my leg swelled up, I'm just short of breath. And so they would treat them to what they could and what they saw and heard. And so then as the months went on, we started to see these people showing up in the ER, mostly by ambulance, and they were in critical condition. And so that brought attention to the fact that we still got a whole population out here of people that they may not have COVID, but they could still die.
Right.
And I mean, not that we didn't already know that, but it's like, how do we reach those people? Mm-hmm. And so Drew, he worked with Jennifer and to get some education out there to the public about, we are going to keep you safe. Mm-hmm. Come on to the ER, and let's get you in here so you could be seen.
And on those same lines, the other challenge has been is visitation has been very restricted from where we normally live in a normal healthcare environment. And so that's been a challenge for a lot of patients, and patients have elected not to receive care because they can't have their loved ones at their bedside for much of it. And we've been able to loosen some of that, and it's kind of been up and down. And as the governor's executive orders have changed, we've tried to mirror as much as what we can safely in our community, but we've seen that's been a consistent challenge. And so communicating with that family member, making sure they're up to date on exactly everything that's happening with their loved one while they're not there to see the doctor or to see the staff. And so we've used technology where we can but it has, continued to be a challenge. And we know our staff is going to deliver that high quality care regardless of what the patient's there for. And we have the utmost confidence in everything. But that one piece it always kind of helps is that family member.
Sure.
They're the extra eyes and ears. And without having those folks there, it's been a challenge. It's different walking through a hospital where you don't have visitors and kind of that
That's right.
vibrancy that you normally have, kind of going on busy surgery days and busy ER days where you just have extra people around. And even today, we do allow, folks to come in and spend time with their loved ones, but it's restricted. And so, we've been trying to work really hard to make sure that, that doesn't diminish the quality of care in the patients or the loved ones' eyes, because they're not getting those frequent updates that they would if they were able to see every doctor that came in and speak with them.
Yeah, because so many times the patient doesn't really comprehend what's being said, and it's the caretaker that's with them that is taking all the notes and everything. So I'm sure that's been hard. Plus, you just feel better when somebody's there that's with you that you know and love and can make you smile. And
hospitals it's a lonely place. I mean, you're in a room, and our staff are checking on them, very frequently. But in between those checks, you got a television and a telephone, and so it's always nice to have that loved one there to kind of pat you on the back. It's going to be okay. And during some of these things, we have to keep the patient safe, but as well as all of our staff. And as the numbers in our community have kind of gone up and down, we've kind of loosened and restricted as we saw that we thought we needed to keep people. But it's been that I think has been one of the most challenging things, is to kind of sit with community members and the like, and try to explain to them why we've had to do what we've had to do when it comes to visitation. Because that's one thing a lot of folks don't often understand is, well, I don't have COVID. Well, we don't know that. And so it's been hard to try to get people to understand that we're doing it really to protect them and everybody else that's there too.
That's right.
Yeah.
Your chest pain, it may mean nothing, but it may take everything. Know the symptoms of a heart attack. If you have any of them, get to the nearest emergency room. We're waiting for you. It's your health, so everything is up to you. Everything. This message brought to you by Woodland Heights Medical Center, home of a nationally accredited chest pain center. Log on to learn more.
Are you interested in buying or selling real estate? I'm Becky Coda, broker and co-owner with my husband Kevin here at Century 21 Coda Realty. We have 21 agents that are highly trained and committed to delivering an extraordinary buying or selling experience. Contact us today to see how we can help you.
Well, y'all are an organization that's been around now 102 years. It's hard to believe. And the Chamber is as well about to celebrate their 102nd birthday. We have been trying to go out and take pictures of different investors that are celebrating big milestones. And I just think that it says so much about our community to have multiple hospitals that have been around for so long. And so tell us, as you're celebrating your 102nd year, what are some new great things that are coming for Woodland Heights? I know that y'all had the first cardiovascular unit at Woodland Heights in Lufkin. And so why don't you tell us some about the hospital and some of the places that you've been and where you're going?
Sure, I'd be happy to. I mean, we have a 102-year track record of, providing extremely high quality care, and we expect that to continue. I mean, our focus has been and will continue to be is keeping people local. And we've been, Lufkin's first hospital way back when, and we intend to keep everybody we can possibly here. So we're working to develop service lines and use technology to layer on to provide a little higher level than where we've been. I mean, we just added a new automated breast ultrasound equipment for certain populations of women that have abnormal mammograms. This is a great way for them to have a little bit of a little deeper look inside. It's a little more sensitive than ultrasound. And it's very good at diagnosing very minor cancers. So we have that online now. We just brought in some new heartburn equipment through the operating room, so the doctors can now actually put a little pH monitor in the patient's esophagus and measure the pH and determine whether they're
It's amazing.
predisposed for things. And so they take a little monitor around for a couple of days, come back, and it helps diagnose kind of what the next step is. And so previously, patients were being sent down to the Woodlands, down to Houston. So we have that technology here now, and so far that service line is growing very quickly.
Yeah.
The general surgeons, that we work with, had all been asking about, hey, we have a lot of these patients. This is a big problem here. And so this was something that we worked together on and are excited. And, we just continue we have great programs, many national awards. And so we're just going to continue to do what we do and try to keep every single person we can here in Lufkin. So, from our perspective, there's no reason to travel when you have great hospitals here in town and lots of very talented physicians. And we're just going to keep, recruiting the best talent we can. And
right.
as medical staff members retire, we're going to keep finding new folks to come to Lufkin and kind of join the family and continue to help us go. So another 102 years to go, right?
That's right. That's right. So I know you have a new beautiful NICU. Would you
do.
tell us about that?
We do 15 beds. It's staffed around the clock with, we always have a physician on call, neonatologist on call, and we have a nurse practitioner in-house 24/7. So we're very fortunate about that. We are certified as a level 2, but we are in pursuit of the level 3. And one of the reasons we didn't qualify for level 3 before is we didn't have the ability to do the retinopathy testing for the infants that are less than like 29 weeks, certain grams. And so we have invested in that, and now we have that technology. Dr. Linda Chase is our neonatologist, and she does a great job with that. We also have started to keep babies less than 30 weeks, and so it's not unusual to go in our NICU now and find a 26, 28, 29 weeker in there.
Wow.
And those are tiny, tiny little babies, and tiny.
And previously, those were babies that had to go to Houston.
They had to go, had to be sent out of
Texas
town.
Children's. Yeah.
And so our goal is that nobody has to ship their baby out of town. And so we are working very closely with the neonatologist to make sure that we keep those babies here. But if they need something, if they needed surgery, we would ship them, and but then they come back to us to finish out, and that helps keep the parents here. We also provide rooms that the parents, if they're trying to breastfeed or they're pumping, it's like, or if they live a ways out of town, we'll let them have a room and stay there and room in so that they can be close to their baby, because that's pretty stressful when you've got one that is touch and go or that small, and you don't want to leave them. So we try to accommodate all that.
Yeah.
So.
And we're also working toward our maternal designation.
Yes.
On the flip side of that, Mama's, that survey will be in December, the end of this year.
So we have the perinatal certification. We were like the 3rd hospital in the nation to get that. But the state of Texas has now said, well, this past year we had to be certified in NICU.
Okay.
And you had to, either be a 1, 2, 3, or 4. And this year, they've started now, we have to do the maternal piece of it, the labor and delivery piece. So we'll be getting our survey, as Jamie said, in December. So we're ready, and we believe that we'll do that. We'll be certified.
Yeah. So I want to talk a little bit about the future. One of the things that's made 2020 so difficult for us has just been the uncertainty, right? Like not knowing when it's going to end or what's going to happen next. I had a basketball coach when I was a kid. We used to do this drill where we would run around the track, and you had to run as fast as you could until the coach would blow the whistle, and that meant you could walk. But what made it so difficult was you didn't know when he was going to blow the whistle. You had no idea. Like, it wasn't run 4 laps and then you get to stop, but then not knowing when it was going to end made it so difficult. As medical professionals, what is your take on the future for us? I mean, I know uncertainty's been, definitely the name of the game for the entire year, but kind of where do you see the future going? How do you see things panning out and changing?
Well, I wish I had a crystal ball and could dial up when a vaccine, because I think a vaccine likely is going to be the next step. I think we'll continue to have peaks and valleys until a vaccination is available kind of nationwide. And kind of where we sit today, it doesn't look like it's going to be coming as quickly maybe as what was originally thought. So we'll see kind of where that leads to. But, from our standpoint in healthcare is a very personal business. I mean, it's person taking care of person in need. And so, I think we can use technology much better, particularly here in East Texas. So, we have a telemedicine program coming online. Great. We've used kind of a minor telemedicine program for doctors that are here locally providing care, just not having to go into the COVID unit. But we're looking at a larger platform with an actual cart that has a stethoscope, so a doctor can be somewhere else in a different state or in another part of our state and physically listen to a patient's heart, listen to their lungs. So we have that technology that'll be going live here before the end of the year. And so we're really excited about that. Will help us, and then we're going to go live with one service to begin with, but there's a lot of capability with that is new services or sub-services come online across the nation to tap into very specialized physicians here in Lufkin that we wouldn't ordinarily be able to have stay and live in a small community that we have. And so we'll be able to tap into them, and they can tap into multiple other hospitals at the same time. So I think technology will be an area that we can, I think figuring out how to, leverage, the physician shortage and nurse shortage isn't getting any easier for us. And so trying to figure out how we can, work through some of those challenges, I think is what the future is going to, look for. And success is going to be figuring out how to work closely with those folks and continue to provide high quality care.
Y'all are typically the ones to give the care. And what we have seen in talking to our guests, especially this month in December, is that the tables were kind of turned. So when COVID happened and you couldn't find the gowns and you couldn't find the mask and you couldn't find the gloves, that the community came together and gave stuff to doctors' offices. They gave stuff to hospitals. And so to be on a receiving end of that, I think it says so much about our community wanting to make sure that the people that were going to be those frontline people were taken care of. Tell us about being on a different side of giving the care and how staff and how y'all as a team reacted to that.
We were honored, to be honest, to receive those things from our community and know that we had that community support and help. And I think it made our frontline staff not feel alone, not feel like they were the only ones out there fighting that fight. Because in the beginning, it was chaos. And it was, like Drew said, learning something new every day, new guidelines being passed down, getting that education out to the staff and keeping them abreast so that they feel safe, that they're taking care of these patients the best that they can.
Yeah.
And I mean, the outpouring of support from the very beginning, and when all of us were kind of just figuring out our way, and many of these businesses that were donating to us or individuals that were providing things were also struggling. And many of them had to close their doors based upon, government mandates or local mandates. And so, to see them, think of us in that time and try to find supplies that they have that may in some way help us was so honoring to us. And we're so thankful for everything that everybody did. And we had people, donate food, and we had people, chalk art all over the hospital entryways and signs, and people come and pray in our parking lot for our staff. And, the local, police department, EMS came out and did a siren salute for our staff one night. I mean, it was just very touching all the way across. And I know a lot of folks who work in other communities around the country, and what our community did for us is much more than what a lot of other communities did. And so we're so thankful to be able to provide care in this community and live here and be such an integral part. So great.
Well, we're excited to see what's next for Woodland Heights and to see what happens in your next 102 years. So anytime that you've got new and great things happening, please let us know. We'd love to share that with our investors and our listeners. So thank y'all so much for being here today. We really appreciate it.
Thank
Thank you for having us.
Thank you.
Yes.
Thank y'all so much for your time, and thank you so much for listening again this week. And please check us out next week, every Monday, when we sit down with local community leaders and business owners and pick their minds and just learn interesting and exciting things about them. If you'll do us a huge favor and subscribe to the podcast if you haven't already, so you get these episodes every Monday. As soon as they come out, you'll be ready to listen to them Monday morning with your coffee, on your drive, on your commute, wherever you want to listen. And also rate and review the podcast if you would. It just helps people find the podcast and learn more about it, and just kind of expands who can listen and learn all these cool things that we talk about. So thank y'all so much, and have a great week.